Let's talk about the diffusion of innovations theory, and this theory is by Everett Rogers. So the theory was initially used in the field of agriculture and back in the 1940s, but then Everett Rogers promoted it in the communications field. It is now considered in our field as a communication theory and has been applied quite a bit, not only in communication, actually, in the field of agriculture, in the field of health, public health, and so many other areas where behavior change is required. We have also seen it being used in the adoption of technology, medical health, and things like that. So yes, so what is the theory premise? The theory focuses on the diffusion or adoption of new ideas. So the premise of the theory is diffusion is a process by which an innovation is communicated through certain channels over time among members of a social system. So we're going to be discussing, these are what we call the constructs. So when you're talking about diffusion, innovation, those are the constructs of the theory. And that's what we want to elaborate on for a little bit. So in terms of this theory, diffusion is about that process of accepting, or if you have a new idea, maybe it's about social change or new behavior. So that process of really getting it into a community or a person, that process of accepting it. Obviously, this theory can be looked at it as a community theory, broader perspective, but it can also be focused towards individuals. So the innovation itself is the idea, the practice, the behavior. Say, for example, you want people to eat healthy, or to even to exercise, or to do something something that's going to reduce the health risk. That is the innovation itself. But how do we get people to really accept it? That's the process of the diffusion. So you could have the diffusion at the individual level when you want people to really accept, for example, to stop smoking. So it does not necessarily have to be something new, but also something that they are required to stop, or even eating junk food, eating healthy and giving up junk food. That is a process. How do you get them to really adopt that new behavior? So the new behavior or practice becomes the innovation. The communication channels is what do you really use, what we use to disseminate or to get people to get the message. So it could be mass media, or it could be interpersonal channels, it could be social media, all kinds of medium, or which way, how do you get the message out to them? So if you're talking about mass media, obviously you're talking about the TV, radio, and all that. And they're very good for awareness. So if you have this whole big issue about a public health issue, then you disseminate the information to them through those channels. Interpersonal channels are much more one-on-one kind of communication, maybe a small group communication, maybe within a hospital setting, doctor-patient communication, and things like that. So you could either use the mass media to disseminate, but then we all know that mass media information sometimes does not lead to behavior change or to persuasion. So that's where we now go to the interpersonal channels to at least to persuade people to accept or adopt behavior. So at the interpersonal level, that's when people can actually try new behaviors. It's almost like when you're buying a product or even a car, you want to go there and test drive it. That's at the interpersonal level. Maybe you've seen it on TV or any kind of device, but then you want to go to the store and talk to the people and test it and touch it and feel it. It's the same thing when it comes to bigger things like health issues and adopting healthy behaviors. There are two key elements when it comes to interpersonal channel, and these are the key terms, heterophiles. That has to do with the people communicating. Are they similar in any way? Or the person communicating, are they similar, which is, or are they different? If they are similar, we call that relationship a heterophilous relationship. When they are so different, whether it's cultural, economic, social, anything, even their attitudes and all that, that makes them have a heterophilous relationship. And then that heterophilous relationship becomes a little bit more difficult when you're trying to get people to adopt new behaviors. So the social system, that has to do with the units within where people actually live. So it could be within families, it could be within a community, and within those communities where people have kind of similar interests, um, they whether it's within the church community or within a political system, or depending on where you want to get the message through. It could be organized groups, community groups. That could also be a social system. But there are also structures. So structures is like you go to a community and there's a church, there's a family structure, there's a school and all that. So those are all, they're kind of interrelated because people, where are you going to meet the people or groups of people? This particular theory emphasizes on communicating. You communicate better and you're more likely to be successful if you go through those social systems. For example, rather than go through a person individual, why don't you go through a school system or within a family system or a church system? So that is what this theory says, that you become more successful when you're disseminating health messages when you go through those organizations. And then the time is another construct of the theory that is also critical. How much time do you need for people to actually adopt the new behavior or the new idea that you're actually promoting? So there are a few things that determines the whether people are going to accept the adoption and how long it's going to take them to adopt an behavior, so, or an innovation. So something like vaccination. Vaccination has been there for a very long time. And there are some people who still don't understand. They don't, well, let me not say understand, who will not accept it. You may think, they have the message, and obviously there's quite a bit of information about vaccination, but there's still some things that, they're not acceptable to people who do not vaccinate. So it may take a very long time for some and probably not enough time for others. So based on the theory, there are two things that determine whether people are going to adopt and the amount of time that they are going to adopt the innovation or the new behavior or practice. And one of them has to do with the characteristics of the innovation, of the behavior or the idea or whatever it is that you're promoting, but also the past characteristics of the person who is promoting the innovation. So those two are important. When it comes to the characteristics of the change agent is the person talking, communicating, and giving the message. We're going to use a model called David Barrow's SMCR model, and you're going to see it in the next slide. And this theory explains why, or model explains why people would accept or adopt or reject a message. And then we just talked about the hemophilias, heterophilias gap. So if you're so different from the people you're communicating with, sometimes the message does not resonate with them. So this is the model that David Barrow developed. And you can see here the source and the receiver, they almost have the same characteristics. So they may not have the same, for example, knowledge. They have to be willing to be knowledgeable, whether it's about the culture. If they don't have the knowledge, then you have to be the first thing that you have to really give them the knowledge. So they need to understand the same, be on the same level when it comes to understanding. Communication skills, that's also important. Say, for example, you're using different languages and the way you package your message, they should be able to unpack it. The social systems have to be kind of similar, or at least you go to the same place where they are. And also culture, things to consider. So understand their culture and then you can communicate with them. All these others have to do with how you package the message. The message code is the language, the content itself is important to make sure that it's relevant. But here for effective communication, I think the resource and the receiver, this is important. Here, it depends, the channel, it depends on what you want people to do with the message. Do you want them to see it? In that case, you may put it in posters, flyers, radio, and TV. If you want them to listen, then that's another thing. Maybe just put it in the radio or podcast. Yes, so this one tells you, depending on how you want people to get the message. Now let's go to the characteristic of the idea of the message or the product itself. And these are the main characteristics that sometimes you have to really get people to see the advantage of the product or the behavior or the idea that you're actually promoting. If they don't understand the advantage of it, then probably they will not accept it. I give an example of, okay, I think now everybody has a cell phone. If someone came and promoted landlines, because I'm sure there are some people who still use landlines, then you'd really want to know what's the advantage of a landline as opposed to the cell phone that we're used to. The older generation probably will understand what it means to have a landline better. So you can think about something like vaccination, right? What is the advantage of vaccinating my kid and what are the disadvantages? So it can be any kind of or any idea, but the idea here is show them the advantage of the product if they have to accept it. Compatibility, that's important and critical. And this is why you show them, okay, how compatible is it with their kind of lifestyle? And here I've given an example of water filters as opposed to a boiling water. We've had some water issues in some communities. I think there's a recent one in Topeka. We've had one in somewhere in Michigan, I think Detroit. How do you really get people to adopt some kind of clean water at least not get affected? And in that case, it will either be boiling water or maybe water filter. So what is more compatible? We've seen that also during disasters like hurricanes and tornadoes, and where people have to read it, they lack clean water. So if you're trying to promote or reducing the reduction of waterborne diseases, so in that case, you'd probably have to look in terms of what is more compatible with the lifestyle that they have at the moment. And then there's complexity. How complex is the behavior that you're actually trying to promote or the product? Is it that easy to adopt? I think something like computer software, that would be so hard. So if you have something to do with them adopting, maybe, and these days people are using apps, right? So how easy is it for the adoption using, or at least accessing the information through those apps? I gave an example of breast pumps as opposed to breastfeeding. People may say, oh yeah, I think breast pumping is so easy. However, breastfeeding may also be easy. And I think we sometimes assume that breastfeeding is easy. Every mother should adopt that, but then it may be very complex for some of the mothers. So so the idea here is really understanding or at least showing them, giving them the skills. So the behavior or the practice is not that complex. It has to be tryable. Can they try something? And if they don't like it, they say, okay, I tried it, doesn't work for me. And here it's almost like this is a bit extreme, but I gave an example of, for example, tasting a new food or new product. That's so easy. You can try it. If you don't like it, you don't even have to swallow it. But there are some behaviors that are more complex. And once you try it, it's permanent, right? And here, I'll give an example of getting a vasectomy or something so permanent when it comes to family planning. So in that case, how do we get that people to really accept that? So it becomes more complex, and then that may be more difficult to adopt. So there's some behaviors that are that complex and that almost impossible to try. And if it's not tryable, then most likely it's going to be more difficult for people to accept. And then observability, can they see and the final product? There are a few things. For example, agriculture, you see the grass is growing, farmers are producing good food and all that. They have high yield. I think if you've grown in the rural settings or in the farming settings, you know, you see when farms are thriving. So if you are, for example, promoting adoption of something that has to do with agriculture, that's easy to see, as opposed to something like family planning. So how do you know how good it is? Can you observe someone who's using family planning as opposed to the other one? You can't. And that is why sometimes you have to really see or think about how you can communicate. So you show them, you know, like positive messages when it comes to something that they cannot see. Other things, weight loss products. I think you've seen that when they always show the before and after, because it's easy to see. You know, you can see how much weight someone has lost. So it's like, okay, I think I can try that because so and so or my friend lost 10 pounds within 10 weeks, you know. So that is easier to observe, and probably that's also easier to adopt as a new behavior as opposed to something that they cannot see. So the other characteristics of the change agents, again, we mentioned the heterophilous. If they're not similar, sometimes they are too highly educated. Maybe they have a degree, a bachelor's degree, master's degree, but then the people you're communicating with are very low literacy. So ideally, you'd have to really understand the education level and lower yourself to that level. So, and sometimes we want to influence the change, and rather than really going to understand them and make sure that they also contribute in that process of change. And then opinion leaders, who are the opinion leaders in the community? So you identify them, and then you can work with them or through them when you're trying to get to the communities itself. Also, when you're trying to when you're so different from the community that you're dealing with, probably you are thinking about communicating with the Hispanic community, and yet you do not speak Spanish. So rather than you trying to learn Spanish, you can communicate with them. This particular theory emphasizes on why don't you go and train aides or people there within the community who can really work as your agents, right? Or agent aides. So you will collaborate with them, but they also help you bridge the gap between the community that you're trying to deal with and yourself. So and this is important, especially when you're dealing with not just the Hispanic, any kind of minority communities. If you're not familiar with them, then probably you need to work with the agents over there in those communities. Remember, again, it's not just about the language, but also the culture, and how you behave. There's so many things that we may not understand if you don't belong in that particular culture. So take time to train, understand them, understand the culture, and then you can easily communicate with them sometimes through the change agent aids. So those are some of the theories that the theory emphasizes, and they're important. So when people are adopting an innovation or behavior, the theory of Everett Rogers categorizes them. It's almost like a normal curve. There are those people who are going to really accept it very quickly. It's almost like you're selling a device or adopting a device. There are those people who are going to buy the newest iPhone within, even before it's get in the market. It's the same thing if you're promoting a healthy product. There are very few, 2.5%. But then you see, and also there are those people who are laggards, right? This is the 16%. This will almost never accept the innovation. Maybe over time, long time, 3, 4, 5 years, they may be able also to accept it. But then there are those who run very quickly, all the way to early adopters. I think early adopters need a little bit more time, more information, but then they also do accept very quickly. But now look at that, about 78%, they are right there in the middle. And this is probably the group you want to focus more on. So if you convince the innovators and early adopters, most likely they will be able to contribute towards adopting or at least convincing these other two groups. So yeah, so that's kind of how it works. So, and when it comes to time, people are going to get excited in the probably first few months, and then maybe a year or so, and then it goes into a plateau. And this is where, probably this is after 1 year, this is where you now start thinking about, how do I change my strategies? So if you're promoting healthy eating, or maybe let's go back to vaccination. People are vaccinating, all of a sudden, okay, we're not getting new numbers. So in that case, think about why you do research and maybe change your strategies at that point. Okay, so Rogers has talks about the process of change. So people have to have the innovation first, at least the knowledge. And then from there, you have to be persuaded that it's good for you. Uh, After that, you decide the decision stage. And then once you decide, then you actually implement the behavior, or buy the product, or change the lifestyle. And then you have to practice that for a few years to say now that I think now I'm completely done. I have accepted this innovation. So if we can apply, for example, in something like nutrition, you need to know about a new diet, learn a little bit about it. Right now, there's quite a bit of emphasis on fasting as a way of health, promoting health, weight loss, and all that. So learn about the best way to fast, and there's so many programs that are for fasting. So you have to really understand the implications, the pros and cons, and all that. And then you have to be persuaded that it's really good for you. From there, you're going to decide and say, okay, I'm going to do it. That process is not a one-time thing. It may take a few months to get to the decision process. And then you say, okay, maybe you need to talk to a few friends. And they also say, don't do it by yourself. Maybe you live in a family setting, and then you actually implement it. Once you implement, maybe you practice for 2, 3 years, and then you can say, okay, I think this works for me. I am, you almost kind of confirm that you have now accepted, and you like it, and it's working for you. So that is how you, yes, so that's the innovations theory by Everett Rogers. And yes, let me know, we'll discuss it more in the discussion board. All right, bye.